Hello, everyone. Thank you for joining. You can drop in the messages in the comment section. We'll wait for a few minutes before Dr. Pathak joins us, and then we'll start with the session. Hi, Gaurav. How are you? How is everyone? How are they doing? Perfect. Hi, Ashutosh. Hi there. You can drop in your questions in the comment section, and we'll get back to those questions towards the end of this. We'll select a few, and then we'll ask Dr. Pathak about these questions. So until you are putting your question, one of my question is to all of you, have you ever donated blood? That's perfect. We are really proud of you, Nitin, Gaurav, Ashutosh, Tanmaya. That's amazing. Hi, Sachin. We'll wait for a few minutes to have the audience and then we'll start with the session. Hi, Aditi. That's perfect. Why not, Shabnam? Are you afraid? Do you have any doubts in your mind? Good evening, Rajkumar. Hi, Raj. Stay with us for a while. We have an amazing session planned ahead. Hi, Soumya Saluja. Hi, Mindicity. Do you have any doubts about donation or blood donation? Are you afraid? You can pop in your questions, doubts, anything in the comments below. Hi, Anita. Hi, Urmimala. To anyone who's joining currently, we are waiting for a few minutes for Dr. Sangeeta to join us. Hi, Garima. Hi, Seema. Okay. I believe we have with us. So let's start with the session without further ado. Well, today we have a very special session with us about blood donation. What is blood donation? Do you know about it? Do you have any myths about it? Well, today we, today we have the Blood Donation Day. The World Blood Donor Day is an annual event observed on 14th of June. And this year, the theme for it is Give Blood, Give plasma, share life, share often. It aims to raise awareness about the blood donation and express gratitude to voluntary blood donors worldwide. So, let's have with us Dr. Sangeeta Pathak with us. Hi, Dr. Sangeeta.
Hi, good evening. How are you all?
Very good evening. Good evening. So, Dr. Pathak. Dr. Sangeeta Pathak is a very prestigious person in the field of transfusion medicine. She has an experience of 26 years in transfusion medicine. She's a secretary of ISBTI and is a recipient of various awards and has pioneer work in various journals and publications. Well, let's have with us without further ado. Hello, ma'am. Welcome to Thip Media.
Thank you.
How are you doing?
I'm great. And today is World Blood Donor Day. So since
Yes,
morning we are having a lot of rush of donors and I'm actually very happy today. Thank you
that's
so much for
amazing.
having me here.
We are most delighted. So, well, we have a lot of audience. They have a lot of questions. We have certain questions. So, can we start the session?
Sure, please.
Yes. So, why at all blood or plasma donation is necessary or required?
Yeah. So, very important. And I always start my answer on this question as why blood is required because everyone can't be a doctor to save life. So, means people say there's one more saying that everywhere God cannot be, so God had sent a mother to the earth. Similarly, I say everyone can't be a doctor, so there are other things which can actually help saving lives, and that is blood donation. And through blood donation you can save once means one person who donates blood can save at least three lives by means because the whole blood is divided into three components can go to various three people, and that helps. And the requirement of blood is so large nowadays because of the surgeries that are happening, the advancements in the surgeries also is that is there. Earlier we never used to hear of CABGs. Now we have CABG, means the cardiac surgery is going on so much. The transplant, we had never heard of transplants in my times. When I was studying in as a student with MBBS, transplant was here and there. We could just hear that there was one transplant, some transplant here. But nowadays it's a routine. Every day we have so many transplants, liver transplant, kidney transplants. And today in my hospital, there was a heart transplant also going on. So,
Okay.
means in all these cases, you need so much of blood. Then the diseases like the oncological diseases, in which the patients who are on chemotherapy, they also need blood. Then our thalassemic children who are there. I was earlier working with Red Cross, and I have so much connect with my these people. So thalassemics, they need every now and then they need blood till the time they actually get cured with some stem cell transplant or some means other methods which are right now present. So otherwise the thalassemics also need blood. Then our sickle cell patients need blood. Then our anemic patients need blood. So the list is long, and means it keeps on going that this is the list of people that need blood, and so the list of donors need to be endless. That's what I want to say here.
True. See, since a lot of people are not familiar about blood donation, some have a lot of myths around it. What is your take on that? Like some people even say it will make me sick or it will weaken my immune system. So, what is your take on dispelling these myths?
Yeah, there are means in our country, we are still a conservative country,
Yeah,
and we might have means progressed so much, but still, of course,
true,
we are the way we are still. And blood donation, when it comes to blood donation, our mothers are the ones who will say, "नहीं नहीं, blood नहीं देना है ना, इतना
true.
मुश्किलों से blood बना है, blood नहीं देना है." So, सबसे पहले, first and foremost request is to the mothers who have young grown up boys and girls कि आप please allow them to donate blood, because donating blood does not cause any weakness. Donating blood increases your healthy cells. Your bone marrow will keep on
Okay.
stimulating your body to get new cells. So it helps in your healthy well-being. And other myths means this is the biggest myth, that once I
Mhm.
donate blood, I will get weak. So
True.
this myth is not there at all. Once you donate blood, your body gets stimulated to grow better cells from your bone marrow.
Okay.
So most of us are of that opinion. So please come
Mhm.
out of that opinion. Second biggest myth which is there is that once I donate blood, I go to a blood
Mhm.
center, I donate blood, I will get some infection. So
Right.
that is also one big myth which is there. So you will not get any infection. Means I vouch on that and take my words. You will not get any infection from the blood center, because the bags which are being used for
Mhm.
your blood donation are sterile bags. They are opened in front of you. The needle which is used is a sterile needle which is opened in front of you, and the bag is a sterile bag. So believe me, you will not get any such infection from the blood center. So these two myths are the biggest myths which
Okay.
prevent people from coming to the blood center and donating.
Okay. You just mentioned something that if I donate blood, I'll have healthier cells. And how is it possible?
Yeah, how is it possible is that our red blood cells are, means everything in our body has a certain lifetime.
Yes.
We on the products also you see expiry dates on
Mhm. Right.
everything, you see an expiry date. So our
Yes.
cellular portion of the blood also has an expiry date. Okay, so
Okay.
expiry date means the red blood cells, they are going to die within 120 days. So
Okay.
means those 120, why do you keep that dead cells within you? Why don't you take them out?
Right.
And once you take them out in the form of the cells, which are actually at that time healthy cells, when you take
Mhm.
them out, your bone marrow gets stimulated. A
Okay.
younger, healthier cellular component starts coming out. And you
Okay.
believe me again, once you start donating blood, you look at the changes that you have within yourself. You can,
Okay.
means you can, uh, right now, just now I saw the people who are joining the talk, means this,
Yes.
there is Amar
Yes.
Singh ji, and Amar Singh ji is the blood man of India. You can
Yes.
ask him,
Yes.
he keeps on donating blood, and you ask him to come anywhere, he will come there and donate blood. So there are people like him who actually, selflessly go and donate blood, and I keep on meeting him. You should see how healthy he is. You should see that.
We are very delighted to have you both here. That's wonderful. So, ma'am, speaking about, you just spoke about infections as well. How can the infections be known before the test? Are there any tests through which I or anyone who wants to donate blood can get tested to prevent any infection?
Okay. So actually, when a normal donation is done, that is a whole blood donation. In the whole blood donation, I'll just briefly tell you the process. So you
Mhm.
register yourself through a questionnaire. You ask, means you ask so many questions about yourself. How do you feel today? Did you have a meal? Means these are, you might feel that what stupid questions are they asking, but they are not stupid questions, because we need to have that faith that you had slept well, you are not empty stomach, because this is
Yes.
not a blood sample which is being given in the lab. It is a 350 ml or a 450 ml blood which is being taken out from you. So you need to be full stomach. I mean, you need to have your proper breakfast or a proper lunch before you go to donate blood. Then once you means this process, after this process, when you fill up the questionnaire, we do a physical examination. Physical examination is we measure your pulse, BP, temperature, and these are measured. These gives us a insight on whether you're okay or not, whether you're fit or not.
Okay.
And means
Um,
we are not examining you fully, but yes,
mhm.
the pulse rate, if not between 60 and 100, if irregular, gives me an insight that there is some problem. If there is, the
Okay.
temperature is 37 degrees, not, it is above or below, it gives me an insight. Yes, I need to ask him not to donate blood and get himself tested and go to a
Okay.
physician. So these are little things that actually tell us that yes, there is something wrong. Then after that, a physical examination. After the physical examination, one big thing which is there, that we do a hemoglobin test, and the
Yeah.
hemoglobin is the biggest marker, along with the other things, that 12.5 and above has to be there for donation.
Okay.
Below that, we will
Okay.
not take the blood donation. And once this 12 means hemoglobin levels are done, then
Mhm.
in case of whole blood donation, we take the blood. We do not
Okay.
do further anything, but we take out the samples and we test the blood after donation for the five mandatory markers, which are HIV, HBV, HCV, syphilis, and malaria. But
Okay.
in case of apheresis donation, that is platelet
Mhm.
donation, when you are doing it on the machine, it's a
Yes.
specialized technique in these cases,
Mhm.
because this technique is a specialized technique. In this case, we do the testing prior to the donation, and
Okay.
the donor is asked to wait till the results of the HIV, HBV, HCV, syphilis, and malaria, till the results do not come, which are usually 55 minutes. The first result come out, so
Okay.
within somewhere between 40 to 55 minutes, we get the entire
Mhm.
results, and the donor is asked to wait in only in case of platelet donation, with which is
Yes.
known as the SDP, single platelet, means single donor platelet concentrate.
Okay. All right. So
Yeah,
few of our guests are also asking question.
yeah,
Some may ask, how long does it take to donate blood? Is it painful?
yeah. Very relevant question, because the pain that actually people think that it's very painful. No, it's not.
Yes.
We all might have got bitten by some insect or something. एक चींटी काटती है, बस वो ही
जी.
नीडल का दर्द होता है, इससे ज्यादा
Okay.
नहीं होता है. So it is not painful. How long it takes? The entire process of filling the form till the time you come out, it's not
Mhm.
beyond, means it's somewhere between 30 to 40 minutes. But the actual process of donation, which is there, it takes only only between 7 to 10 minutes. The needle,
Okay.
when it goes inside you, and when the
Mhm.
blood is taken out, that just takes
Okay.
somewhere between 7 to 10 minutes, not beyond that.
Okay. All right. I believe that answers your question. Okay. Moving on. Um, you just spoke about a lot of infections, how safe donation is. Are there any necessary tests which would be done on the recipient also before donating blood or receiving
Recipients,
blood?
the recipients usually, see, they are not tested, and they that would be a hospital policy, basically, on what they
Mhm.
would like to test
Okay.
the recipient before taking the recipient on a surgery. Like in the COVID
Mhm.
times, it was a
Yes.
mandatory test. The COVID test was a mandatory test before
Yes.
getting the patient onto the OT table. So it depends on the hospital policy for the recipient. From the
Okay.
blood bank point of view, blood centers do
Mhm.
not insist on any test for the recipient. No.
Okay. Okay. What are the key challenges which are being faced by our healthcare system in maintaining a safe and sufficient supply?
Okay. So safe blood is definitely the requirement of the time, and
Yes.
our government is putting in a big effort to run only the licensed blood banks. These
Mhm.
licensed blood banks, which are there, can
Yeah.
means they are supposed to do the mandatory testing, and the blood
Mhm.
which comes out of these licensed centers
Yes.
definitely are, means they are on the norms that are laid down by the government. Might, I
Okay.
don't know whether there would be other centers running, but I am doubtful if such centers are running. Second thing that you asked me is the
Mhm.
challenges for the safe and uh,
Safe blood donation.
no, safe is
Safe
this,
and
I told you.
sufficient. Safe and sufficient.
Yeah,
Like,
sufficient. I'll come to that
yeah.
sufficient point. Is that we are a huge population, and we are nearing to China. I suppose we are
We have
past
crossed.
China.
We
We
have
have
crossed.
we have crossed the China population as well. But
Yeah.
the biggest, the pain point is that we do not donate blood. None of us are
True.
motivated to donate blood. So the sufficiency is a question, and
Mhm.
definitely the data which is there in the Indian scenario is that 13 million units of blood are required, and only
Mhm.
11.11 or 11.5 million are always collected in these past
Okay.
years, and there is always a gap which is left out, and this gap is definitely painful because many people, when they're not getting the blood, then that's
Mhm.
means they must be,
Mhm.
suppose it's a pph patient, obstetrical hemorrhage patient might be
Mhm.
dying because if she's not getting the blood in time, and there must be such cases which are going on. So I'll urge from this platform all my youngsters, they need to donate blood. And we are a 1 billion population, and 1% of us, even 1% of us, donating once a year, on your birthdays, on your anniversaries, on your parents' anniversaries, on your some means
Every
important
special
day.
occasion.
So important day you can, you means that is sufficient enough to keep us going, isn't it?
Yes.
That sounds very
True.
simple, but
True.
somehow it is not happening. And we all need to, not only means when our relatives are admitted in the hospital, it's every
Mhm.
time, every moment, every second, every minute, someone or the other needs blood. So
Yes.
please think on that and please donate blood.
Yes. You just spoke on safe donating. So I have heard a term which is called as NAT. Could you please elaborate on that?
Yeah, definitely. So I just now I told you, we it's a mandate to do 5 tests. That is HBV,
Yes.
HCV, syphilis, and malaria. And but the mandate says that you have to test it serologically. Okay,
Okay.
this is a
Mhm.
means you can test it by various methods, but
Mhm.
NAT, as you said, the nucleic acid testing
Yes.
method, this
Yes.
method is a test. In serology, we detect either the antigen or the antibody. Okay,
Right.
now the antibody will develop only after some time. Some virus
Mhm.
has entered your body, immediately
Yes.
antibody nahi banega, isn't it?
Okay.
It's not
Mhm.
immediately, it takes
Mhm.
certain amount of time, days. So, and we can only detect the antibody once it is there in the plasma, otherwise not. So this period which is there, once the donor comes and donates with me, suppose he is HIV positive and he comes and donates, and
Mhm.
I will not be able to detect it because the antibody has not formed. So I will not be able
Okay.
to detect. And I'll take the blood, I'll test him. Test would be negative, and I'll
Mhm.
give the blood to someone. So what is NAT?
Okay.
NAT decreases this window period in which you
Okay.
can detect the virus. So once
Okay.
suppose you had an infection, and
Mhm.
the incubation period means 21 days after we can detect HIV. But in NAT, there are two methods. So the methods claim different days of detecting. One of the methods claim it for 2 days, the other methods claim it for 5 days. So this is two
Okay.
and fifth day or fourth, fifth day, they can detect
Mhm.
the virus. See how helpful it is.
Okay.
And it
True.
applies to HBV also, it applies to the this
HIV.
also, HBV and HCV and HIV as well, or to all three. So
Okay.
NAT is being done for all these three tests, for HIV,
Okay.
HBV, and HCV.
Okay. So apart from NAT, are there some other tests which can also be done
Yes,
and
we
some
can see
screening
that.
tests?
So the hospitals will see the mandate says 5 tests.
Right.
And if I look at the means transmission of the viruses, the
Mhm.
bacterias, the
Mhm.
prions, the other infectious things, it's a huge list which is there.
Yes.
But the mandate, as per the government, you have to follow the law of the country. So as
Yes.
per our law in India,
Mhm.
we will do only 5 tests. The
Okay.
method of doing the test can vary. First,
Mhm.
serology is mandate by the drugs and
Okay.
cosmetics. I mean, we are under the DCGI, the Drug Controller
Mhm.
General of India, and as per them, serological testing is must. Is must. So we
Okay.
have to do that. But then we can have a extra layer of safety by adding NAT into it. Okay,
Okay.
so that's what most of the good centers, will have NAT with them, and they'll be doing testing by that.
Okay. So we have a few questions from our viewers. Someone said that can I take the NAT test in any laboratory even if I'm not donating blood at that time?
Yes, why not? You can go to a lab, pathology lab, and ask them to do that. I want to get myself screened for HIV or HBV or HCV. You can, but the blood center is not going to do that because we do not test the blood for patients or other than people who donate blood. We are not supposed
O-
to. So you have to go to a pathology lab to get it. You would be able to do that. You can get it.
Okay. All right. Okay. So before going on to the questions by our viewers, I have one more question to you. Like, what role does public awareness play in promoting safe blood donation?
Great role. It's such a big role, but
Mm.
somehow we lack in that. And why we lack in that is because the population that we have is more of a illiterate population. एंड आप कितना भी समझाएंगे उन्हें ब्लड का तो समझ ही नहीं आता है एंड बट येस आई वुड ऐड टू दिस दैट अवेयरनेस ऑन द डोनेशन ऑफ ब्लड इज highly recommended, and wherever, whenever, however it's possible, we should educate our people around us to donate blood, because the awareness levels, because of the type of population we have, definitely we lack in that, and we need to explain more. We need to have focused means focused programs on that. We can't
Right.
just means leave that onus on the blood center or on the means only the concerned people. We should have some directives from a government also, and we should have some initiatives from them also, though we have a lot of such programs, but yes, they need to pick up more pace regarding this. I always feel that, because the number
Okay.
of, and one more thing, the number of voluntary donations is so less.
True.
Means a country like Sri Lanka has 100% voluntary donation, and a
Wow.
country which is 10 times, 20 times, 30 times the size of Sri Lanka lags
Right.
behind in a voluntary donation, which I somehow again don't like it. And so the awareness regarding the voluntary donation, it needs to be increased. It needs to be.
Okay. Um, in lieu of this only, Sujata asked that there are a lot of blood donating camps organized by local clubs. How do you know which is a genuine camp for a licensed blood bank? And what are the hygiene factors a donor should be careful about?
Yeah, correct. See, so nowadays, uh, there are a lot of blood banks. The
Yes.
distribution of blood banks is not as per that we want. Suppose Delhi might be having 73 blood banks. The exact number I
Mhm.
don't means might not be quoting, but huge number of blood banks in a particular area not required. So the distribution of blood bank needs to be rethought upon. And similarly, if I talk of just now when you that you're asking me, like there are lots of, Kolkata has voluntary donation to I don't know what levels, 100% only, I suppose, highest.
Okay.
But yes, I agree to you that how do you know that these are real
Yes.
genuine camps, and that, so I'll urge you, the donors who are there with
Mhm.
Kolkata, at least you should, when you're staying there, you know that local people know each other so well. So just analyze the people who are coming for the blood donation camp. Just see that how is the camp. The camp should be actually in an AC area. Air conditioned area is first thing that is required for a camp
Okay.
as per the government, but those norms are not being followed. I know that. There could
Yes.
be a tent. In a tent, the
True.
temperatures are soaring high. The patients, our donors are donating there, and at times it happens that people are just getting it donated for the heck of their own center. So please
Mm.
do not go to such centers where you think that the hygiene levels are also not good. Hygiene should be
Okay.
exactly the same as it is in a blood center. It should be good, neat, and clean. And the
Mm.
hygiene level also, why should you donate in a place where there are flies roaming around, where there is a dirt around. Why should you do that? So you should not go to such center. That hygiene level you can also see for yourself. Don't go to such centers. I'll recommend that.
Okay. So, in continuation with this, Soumya Saluja asks that can people with high blood pressure donate? If so, are there any precautions hypertensive donors should take care of?
Whenever you have a blood pressure, I'm
Hmm.
sure that you already know it and you are already on medications. At times, it comes as a shock. At times, that your
Right.
blood pressure is high but that often happens because it's a means the fear of the white coat. My doctor who's measuring the blood pressure sitting in front of you, your blood pressure starts shooting. That can be there, but if you are a patient, a hypertensive patient, if you're controlled, your blood pressure is controlled, there is no reason that you can't donate. You can donate blood. And in
Okay.
cases of such people where
Hmm.
the this blood pressure shoots, they don't know it, and the blood pressure shoots in front of us, then we make
Yes.
them sit, we make them comfortable, we ask them to come after half an hour, and we remeasure the blood pressure. So don't worry on that. We are going to look after you well when you come to donate with us.
Okay.
Yeah.
On that note only, one of our previous commenters that I have seen someone fainting after donating blood. Can I also face the same? Is
Yeah.
it?
Yeah, it is. It's a vasovagal reaction. This is known as a vasovagal reaction. So,
Okay.
why it happens that you are there to donate blood and you are from within, you are so scared that means besides the biological, there is a psychological factor also which starts playing with you, and and if you are not properly hydrated,
Mhm.
this also adds to your vasovagal reaction. So, what happens suddenly? When you've donated blood, a 350 or 450 ml of blood is out from your body, and when you're donating, suddenly you feel there is lightheadedness in your head,
Yes.
means lightheadedness you feel, and you start feeling dizzy.
Yes.
So this could also be because of that you are not properly hydrated. So my one suggestion to all the donors who are listening from this platform, please have good amount of water before and even after the donation. You this feeling of you will never have a vasovagal reaction in life, never.
Okay. Okay. Another one has asked by Dr. Suresh Kanan, how early O negative blood can be given in emergency?
2 minutes.
2 minutes. Okay.
It's just two
Got
minutes
that.
that it can be given. Why? Because our protocol says that whenever suppose it's a gunshot injury which comes to your
Yes.
triage, a gunshot
Mhm.
injury doesn't have that much time that you cross match the blood, you do this, you do that, the
Yes.
patient will die off because a
Yes.
gunshot will bleed like a tap. If someone has opened the
Okay.
tap and the patient will die. So
Okay.
whenever there is such cases, whenever you get such cases, within two
Mhm.
minutes your triage sends a request with unknown. We don't even ask the patient's name. The request comes as
Okay.
unknown, uncross match
Mhm.
blood required. 2 units of O negative uncross match blood required. And
Mhm.
immediately, 2 minutes, we ask one of our staff to rush down to the triage to give it. And it's 2 minutes, the maximum earliest that blood can be given to such patients.
Okay. Okay. Next, Utpal Sen Gupta is asking, is there any age limit to donate blood?
Of course, yes,
Yes.
it is. It is. So 18 years is the lower limit, while the
Yes.
above limit is 65. But 65 doesn't mean that at 65 you come to first time come and donate with me. It's that if you
Okay.
are donating blood 60 years onwards also, then I will allow you
Mhm.
to donate till 65 years of age.
Okay.
Yeah.
And since we are speaking about the age group, like 60, 65, Aarti Bhomik has a question. Can a diabetic patient donate blood? Like, diabetes, hypertension are more prevalent in this age group. So what's that?
Correct. So diabetes, yes, can donate, and this is one of the bahanas that one of most of my donors will make. Hey, हमें तो diabetes है,
Okay.
and they'll run away. So I'll say diabetes है, no,
Okay.
you can donate. Come here. If you're not on insulin, If you're not on
Yes.
insulin and if your sugar is controlled with the oral hypoglycemics, एक गोली से controlled है, oral आप
जी,
ले रहे हैं मुंह में डाल के, तो आप
जी।
डायबिटीज होने के बावजूद आप डोनेट कर सकते हैं.
Okay,
Only the
okay.
people who are
So,
on insulin can't donate. Okay.
okay. So, one more question on if not donate blood. There is Priyadarshini Singh asking, do tattoos affect a person's eligibility to donate blood?
Of course, yes, it affects. For
Okay.
1 year, you are debarred from donating blood once you get yourself tattooed. Why? Because those needles which are being used, they
Mhm.
can be a source of infection. They can be a source of HIV, HBV, HCV. So the
Okay.
incubation time till these diseases are there, we will not take blood from you. And I'm forgetting the
Right.
name of one of the player, football player, a very famous football player and a tennis
Mhm.
player who do not get themselves tattooed because of this reason that we need to donate blood. So,
Yes.
again, my request to all the ones who are listening to me here. So, to avoid this, do not get yourself tattooed if you have if you have thought of
Okay.
donating blood. But still,
Okay.
after 1 year, you can donate.
All right. Again, on the same note, if I can donate. So, if someone smokes or drinks alcohol, how many days shall one refrain from before donating blood?
Okay. So then the logic behind alcohol is what? Means there are boys who come in and walk in and say, Madam, kal liya tha humne to. They'll be joking with us. So I feel like telling them, come on. It is the alcohol factor is why we add that alcohol factor is I'm asking you to fill up a questionnaire. If you're in a
Yes.
state of inebriated state, you won't be able to
Mhm.
fill that form properly. And I want you to answer it in a clear mind. I need those answers very clearly and honestly. अभी आप अल्कोहल पी के आ जाएंगे तो क्या भरेंगे उसको. So we do not allow alcohol
Mhm.
at least 24 hours prior. You should have not taken alcohol. And smoking, why? Smoking, most of them will deny we have not smoked. Smoking
Yes.
is why we say no is because it falsely increases the hemoglobin level.
Okay.
So for us it is, the when we actually make the means it is not good for our patients. The blood
Mhm.
that recipients should be means safe also. So once you are donating, if your hemoglobin is about 11, it might come
Mhm.
to 12 once you are smoking. So please do not smoke before you donate blood. That's again a request to all of you.
Okay. So, Ashutosh Singh has one question. Why different blood bank have different price for blood components?
No, it is not different. And the price is capped by the government. And we
Okay.
all follow that government rules quite strictly. But the
Mhm.
prices vary because, suppose if I'm doing a NAT testing and if my
Mhm.
fellow blood bank is not doing it, so I
Mhm.
am going to charge for the NAT testing as per the government mandate. So I
Okay.
am means entitled to means charge 1200 rupees extra for NAT testing.
Okay.
So that way, once you're doing those tests, suppose there's a phenotyping. If you're doing an
Mhm.
extended phenotyping of blood, which my fellow blood center is not doing, so I am entitled to charge for that extended phenotyping as well, which is as per the
Okay.
government mandate. So all the
Okay.
price which are there are actually capped by the government, but they vary as per the means tests that are being performed in the blood center.
Love it.
Yeah,
Okay. Two, three more questions. Soumya
yeah.
Saluja asks, how many times a healthy person can donate blood every year?
Okay. So every year, a male can donate every 3 months. A male can donate every 3 months, while a female can donate only after 4 months. This is also as per the new act that has come. Earlier, it was
Mhm.
common for both 3 months, but now the female
Okay.
donors can donate after 4 months, whilst a male donor can donate every 3 months.
Okay, ma'am, why is the difference there between males and because of the
Because
hemoglobin?
because of the hemoglobin, yes, and the restoration of the hemoglobin to normal levels. Because
Okay,
the
all right.
females also means monthly they do lose a certain amount of blood in the form of menstruations. So that's
Yes.
what the recovery of the blood is
Mhm.
with that time limit.
Okay. All right. I believe we have covered all of the questions by our viewers.
Okay, I can see one more question. Do piercing
Yes.
affects eligibility to donate blood?
Yes. Garima has asked, do piercing
So
affect?
Garima is asking this. So Garima, piercing means you, though there is no piercing of these, I suppose needles and all that, you put one something
Yes,
here,
yes.
something here,
Yes,
isn't
yes.
it? I suppose she's asking that
Different
piercing.
places. Yes.
So
Multiple on
piercing
the
as such,
earlobes.
yeah. So piercing as such has no mention in our Drug and Cosmetic Act. So I don't think so. It affects,
Okay.
it does not. Until unless there's
Okay.
some infection on that site, obviously, then you can't donate. Because if you get yourself pierced somewhere here in on your eyebrow and there is a
Hmm.
visible infection which I can see, so definitely it's a no, no, no. Till the time the
Okay.
infection clears.
Okay. All
Okay.
right. Okay. Just a second. Um, there is a question by Neelam Singh. There are several professional donors who sell blood for money. How a receiver can trust them?
See this question because professional donors are actually barred through an act by the
Okay.
Supreme Court.
All
And
right.
so I we do not, when I was doing my post graduation in transfusion medicine at Jaipur SMS,
Hmm.
that time we used to get so many professional donors. At that time the
Okay.
act had not come and it was long back. I did it in
Okay.
97, 96, 97. So at that time
Okay.
there were no such act and they used to come, madam humse koi service le lo madam. I would say, what are they talking, who are they? Then my 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 lab technicians would say, ma'am aapko nahi pata, ruko abhi hum inko batate hain. And they would take them inside and they would hit them here on the knuckles with a ruler. And I would say, no, no, no,
Okay.
don't do it in front of me, please. Don't do that. And then,
Okay.
but they used to say, ma'am, this is the way we have to put them off because they
Okay.
sell the blood. But this was, I'm talking about 30 years back, isn't it? So nowadays it is barred. Professional donors are not allowed, but I don't
Okay.
know if they come to you in some other disguise, that I really don't know. But at least
Okay.
we have methods how to see that he's not a professional donor also. That if there are multiple marks on the forearm side where you donate blood, then it
Mhm.
that person is a sure shot professional donor and we will not take the blood.
Okay.
Okay,
All right.
so be careful
Okay.
on such things and do not get
Okay.
trapped with these professional donors.
So one last question, and I would like to end this session on the safe blood donation. Neelam Singh has a question. How can safety of blood be ensured, especially when there are professional donors?
As per me, there are no professional donors, and we are
Okay,
very
so
careful. We are very careful in selection of the donors. If I tell you, नीलम सिंह जी, इतना बड़ा हमारा गैजेट है, इतना मोटा गैजेट है. The gazette
okay,
defines कि किसको आपको ब्लड लेना है, किसको नहीं लेना है. And
okay.
these norms are tested now and then. They are
Mhm.
inspected by the drug inspectors. We have accreditation bodies which keep on seeing such things. So I do not believe that there are professional donors. But अगर
Okay,
आपको ब्लड नहीं मिल रहा है कहीं से, प्लीज इनके ट्रैप में ना आए. अगर आपको लगता है, you can always come up front and ask for help from us and we would be able to help you out. So don't worry on that कि कहाँ से blood लाएंगे. That is a
okay,
means later story. At least for the patient, we will never, at least at my center, I will never ask for blood. पहले blood जमा
okay,
करो और फिर मैं आपको सर्जरी होने दूंगी. I do not do that.
okay. So please, I would request you to end the note on safe blood donation, NAT testing, these practices. I want a summary of this. What our audience should take back from this session?
सो ऑडियंस शुड टेक बैक. सबसे पहले तो वॉलंटरी डोनेशन करो, बहुत सारा. वॉलंटरी डोनर्स आर रियली रिक्वायर्ड इन दिस कंट्री. वी कीप ऑन चेजिंग द फैमिली रिलेटिव्स, भाई डोनेट करो, डोनेट करो, डोनेट करो. बट फैमिली रिलेटिव्स, व्हाई दे आर नॉट safe? Because they are going to hide so many things from you, क्योंकि वो फैमिली प्रेशराइज कर रही है, जाके ब्लड दे क्या, जाके ब्लड दे क्या, सर्जरी होनी है, ये होना है, वो होना है. So he is
Mm-hmm.
going to hide so many things from you. And the
Yes.
blood which is tested might be that window period mein ho and I'm not able to test it. My fellow beings are not doing NAT testing. They would not be able to test it. So sabse
Mm-hmm.
pehla, my request to all of you who are hearing is, please increase the voluntary donation of our country. Secondly, the ones who are not being able to donate blood because of reasons which are there, too many reasons, please motivate the people around you to donate. That is another one big thing. Thirdly, the testing which is there, we need to switch on. My government also need to switch on to better methods like the NAT testing, because it's the
Yes.
need of the hour. It is the need of the hour. And
Yes.
I'll means wind this up on that note, that the WHO theme for today's World Blood Donor Day is give blood, give
Yes.
plasma, share life, share often. So just rethink and reread this, and just go through it. It's such a good theme. Give blood, give plasma, share life, share often.
Share of
Such a
him.
good theme. So that's my
Yes.
closing note, that please reread it, reread it, reread it, and come to our centers to please donate more and more blood voluntarily. Thank you.
Okay, thank you so much for being here. It was a super informative session. All our viewers are loving it, as we can see in the comment section. So, Dr. Sangeeta, it was a wonderful session with you.
Even
So,
I
our
enjoyed
my
it.
viewers, so did we. Thank you so much.
Thank you so
So, our
much.
viewers, thank you,
Bye bye.
ma'am. Have a
Bye
good
bye.
bye bye.
Namaskar. Stay healthy.
Namaskar.
Keep donating.
Yes,
Bye bye.
ma'am. So,
Bye bye.
viewers, bye. Okay.
Bye.